Thank you so much. Thank you, everybody. Thank you, Statis and Foscom, for having me once again at this wonderful conference. Today we're going to be talking about why we use free and Libre software. In my case, I put the effort on social medicine and health informatics, and why it's important of having free and Libre software in the public administration, especially in the public health sector. So we'll just go through the agenda very quickly. We'll talk about a little bit about the history of the project, some of the components, what is the MyGNUHealth, the GNU Health personal health record. We'll dive into a little bit on the technical details of this application, and hopefully we'll have some time for questions and answers. About myself, there you have my email address, falcon@gnuhealth.org. Please write me any questions that you may have about these presentations or about the project in general. My background, I'm a physician by training, a computer scientist, and my specialization is on genomics and medical genetics. And on my daily activist tasks, I have animal rights and social medicine. And within social medicine, we have the GNU Health project. This was the origin of the project. This is in Argentina back in 2006. And this is a rural school in the north of the country, in Santiago del Estero, where I noticed that these kids needed more than just technology. That's where I started to work with rural doctors and nurses and social workers to improve the lives of those inhabitants on rural areas. And by combining the knowledge that I had of medicine and computer science, that's where the GNU Health project came to life. GNU Solidario is the organization behind GNU Health. It's an NGO. It's a humanitarian non-for-profit NGO. And we work on the areas of social medicine, animal rights, and health informatics. We try to combine those components into our daily activities. In the case of GNU Health, it's an official GNU project. It's hosted at Savannah. We have mirrors in many universities and other institutions around the world, and we come with a friendly international community. And it has been translated to many languages today. This is just a picture of the GNU Health Con. By the way, we'll have GNU Health Con 2021 in December, this December 10th and 11th. So I welcome you all to join us. And there is our friend Statis from the Greek community on it. It's important that every single component within a free software project is Libre, right? If we have any of these components that is proprietary, then the whole change of evolution goes down the drain. So that's one of the hardest part that we have within any large project that's in the GNU Health ecosystem. Making sure that every piece of software, every operating system, every database, programming language or whatever is free and will remain free. So same with the documentation. We document everything on a public portal. if we look at the ecosystem, in this case, you will see different components. In this specific example, we are showing the hospital information system, where we have 4 main areas, right? The very first one is the demographics. I usually say that we need to work more on people before patients, and keeping the our society healthy. Then we move on to electronic health records, hospital management, and demographics, epidemiology, analytics, and so on. Right. These are some pictures. So we have areas from histopathology, diagnostic imaging, of course, everything related to terms and the agenda that every health professional or health institution needs. And then, of course, we have graphics, right? We have graphs, we have charts. In this case, we are showing pediatric growth charts, demographics on the population pyramid, and so on. Here is an example on the integration of Orthanc, which is a free and Libre PACS server with GNU Health. So within the GNU Health, you can actually, access to whatever tags, MRIs, X-rays, or whatever diagnostic imaging services that you have done to your patients. To build these sort of projects, you need an international community. You need a large community and diverse community too, right? So in this case, what we're showing is how we work with academic institutions, right? Those building blocks with the academic institutions allow us to grow in different countries and in different sort of institutions, right? So we are in small clinics in the heart of Africa to very large institutions in India. Here we're showing one example in Laos with the Ministry of Health in that country, Jamaica. Also, the Ministry of Health was the one who adopted GNU Health, was one of the early adopters of this project back in 2013 or so. This is Cameroon. Very interesting how you see the 2 main pillars of a society, right? So you have the school and you have the health institution, very close, and people from all over the country converge to these places to get cured and get help, get education, and so on, right? Solar energy, we're using OpenSUSE in this case, and you will see, you can see on the lower right corner the servers running 24/7 in this clinic. This is one of the examples on the areas of social medicine, which is so important to have. And we have many other projects across Africa here, showing some tropical medicine laboratories in Ghana, some institutions in Gambia, Cameroon, Gabon, Tanzania, Congo, Kenya, etc. This is all within the African continent. AIIMS, the All India Institute of Medical Sciences, this is one of the largest, if not the largest hospital in Asia, over 3,500 beds. They have an IT team, over 50 people some of them are the ones who are showing this picture, 2018. And they did also choose GNU Health for the institution. Right? So this sort of projects make us very proud, because at the end of the day, you know, we don't count with large financial background or anything like that. This is all voluntary work from an international community of people that really believes in social medicine, that believes that health is a non-negotiable human right, and you know, it's our duty at the end of the day. You know, we are very gifted by living where we live, and therefore we have the moral right to help those who need it most. That's pretty much it. So if you know computers and if you know medicine, do something about it, and that's what we do. Another example is the Red Cross in Mexico. Some multilateral organizations like United Nations. This is the United Nations University, the International Institute for Global Health, which is in Malaysia, Kuala Lumpur. And what I did in that case was training the personnel, so then they could train the health professionals, mostly in Southern Asia and North Africa. Those were most of the people who went to get trained in GNU Health. And WHO, the World Health Organization, we did and we do campaigns with them. We have the Bafia District Hospital. That's the picture of the very first patient that we have, this little baby, on this hospital. We do train the team from WHO in the Western Africa area. And of course, we use many of their standards, like the disease coding system, ICD-10. Now we are using ICD-11, ICPM, pediatric growth charts, vaccination campaigns, list of essential medicines, and so on. This is one of the latest projects that we have. It's related to Argentina, and the government of Argentina chose GNU Health as the real-time COVID-19 observatory for Entre Rios province. And now it is not only for COVID, but for any transmittable disease. They can use GNU Health on it. As I said, this is an official GNU package. All of these components are free software. And here you have the main components of this ecosystem. And the one that I'm going to be talking now is MyGNUHealth, right? But you have others. You have bioinformatics, you have GNU Health in single board computers, and you have the federation to build very large network nationwide, right? So what is MyGNUHealth? MyGNUHealth is an application focused on personal health. That is, now we are talking of a tool that is intended to be used by people that are not health professionals, regular people that wants to keep track of their health. These are some of the technical components. So it's written on Python using PySci2. This is a project of our friend Christian Moreira. We also use Matplotlib for charts, Qt as the main framework, and GNU-PG for encryption and privacy, and TinyDB for the DB. So as I said, Python is the main programming language, which is also shared with other components of the MyGNUHealth ecosystem. We use, as I said, the Qt framework. And Kirigami is a framework that allows you to create convergent application. That means that whatever, with a single code, you can have that application shown beautifully on a desktop and also on your mobile phone. This is just screenshot showing that it's a Python program, basically, or a set of modules. These are also some screenshots. As you can see, we are going to be always dealing with the three main spheres of health, right? So you have the biological, but you also have psychological and social determinants of health. And the three of them are very important, and the three of them complement to each other and interact. Again, the Book of Life, the health tracker shown at the desktop. And here you have MyGNUHealth running on the PyPhone. PyPhone is a free mobile phone, right? Some others screenshots dealing with lifestyle, physical activity, nutrition, sleep, quantity and quality, and so on. But you also have genomics and you have genetics. So, for example, MyGNUHealth has over almost 80,000 different natural variants that you can choose to include on your health history, your clinical history. The local storage, as I said, is TinyDB. It's a beautiful, small document-oriented database. It's JSON encoded and is compatible with Python 3. So it's very easy to port it from one platform to the other. Now, we want to make sure that we don't want to work with isolated databases. That's what happens in many countries today. Many health institutions, they work with their health record, but they don't share the information within the system of health. And what GNU Health project proposes is exactly the contrary. We need to share data within institutions across the country or across the region, if we are talking about Europe, right? So if I have my sprained ankle in Gran Canaria, in Spain, and tomorrow I travel to Germany, that doctor can see my clinical history in Hanover or Berlin or wherever I go there, right? That's not happening today. And we offer the technology to be able to replicate in real time the clinical and demographic information of the population, no matter where you are in Europe. And this is how, in this case, MyGNUHealth couples with the GNU Health Federation and is able to update information within it. I will leave this presentation. It's already there, so you can read it later on and with more time. As I was talking, here is an example of the medical genetics and bioinformatics information that we cover within the GNU Health ecosystem. Here is just one example of the BRCA1 gene and the different natural variations and mutations with the different clinical significance of each of it. So if we really want to advance in bioinformatics, we really need open science, and GNU Health is all about open science. the real-time observatory, not only for infectious diseases, but for any sort of health conditions, including social medicine, right? Including family violence, domestic violence, bullying, etc., etc. The hub is there, so anyone that wants to try it out, anyone who wants to develop something, you have a 24/7 network that allows you to connect there, play around with it, develop your own modules and packages for GNU Health, and share with the community. As I said at the beginning, it's very important that we have this link with the academia. So many times, as you know, in the Macedonia University, that's what we try to do. It's a matter of passing the message. It's a matter of having students, not only in health science, but in the social sciences, to embrace Libre Software as a sustainable mean for our society. It's clear that we are not going to go farther or far with proprietary software. If we pay taxes, we need to have Libre Software in our society, in our public administration. Otherwise, it's not ethical, and we have to tell our governments that they should use free software in the public administration system. You cannot have privacy in public health if you don't use free software. They are just not compatible. Actually, proprietary software and privacy are antagonic. They just don't. It's impossible that they can go together. So please, anytime that you see a public representative, tell them and ask them to use free software. And if you are visiting your doctor, your nurse, your nutritionist, ask them if they are using free software in their offices, because they should. It is your right as an individual to have your data private. This is an example of how well it works, the academic partnership that we do with different institutions around the world. This is the UNER, Entre Rios National University. They not only develop packages for GNU Health at the dentistry package that we are seeing here, but they work both nationally and internationally. As I said before, the COVID observatory is done in Argentina, but they also travel to different countries in Africa to install GNU Health and implement GNU Health in different health institutions. So it's key to have academic institutions within our network. This is another beautiful example. We have the IFMSA Bangladesh, which is the Federation of medical students. We count now with over 60 universities, 65 universities across the country with 3,500 students, medical students, working on GNU Health, working on primary care, and working on delivering universal health care across the country. And you can only do that using free software, because when you use free software, you are using a philosophy, right? It's not a product, it's not a license, it's how you envision your society, right? And this concept of equality and freedom and cooperation comes from free software. It doesn't come.
Sorry to interrupt you. You have about 10 minutes to wrap up. All right.
Thank you, George.
All right. Thank you.
So it's these concepts are key, and it's not about technology, but it's about philosophy, right? And we cannot build empathetic and modern societies if we don't cooperate. We can see how we are building a trash bin out of this world. We can see how the climate emergency is going to destroy our habitat. But yet many people is still eating meat. And science cannot advance by killing thousands and thousands of innocent sentient beings every single day. So that's why free software is important, because you are getting these concepts of partnership, of cooperations, of empathy, universality, privacy, that only can be developed within this framework. This is just Argentina, and you see how many people are behind the project, you know, from programmers, researchers, professors, etc. Finally, this is a very nice video. Here is the documentary. You can click on it if you download the presentation later on. It's called Cancer as a Result of Social Injustice. And basically, this summarizes what we want to achieve with GNU Health and the social medicine using health informatics. GNU Health is basically a social project, right? And if you see the video, you will see the prevalence and incidence of different type of cancers, how it's incremented in areas where people is more vulnerable, you know. We've seen it with the COVID pandemic. We've seen it with diabetes. We see it with heart disease, and we see it with poverty. They all go together. And if you trace them up and you overlay the different health conditions, heart disease, diabetes, poverty, you will see that the levels of prevalence and incidence of these health conditions are always the same areas. Is where the people are most vulnerable, is where the people is more poor. And we have to change that. And it's our moral duty to change this. And we, no matter what you do, if you are lucky enough to live in a place where we live, most of us, then it's our moral duty to give a hand and give voice to those that don't have it today. So yes, this GNU Health is a social project with some technology behind. And I always like to wrap up the presentations with this phrase of the father of social medicine, Rudolf Virchow, who said that medicine is a social science and politics nothing but medicine at a large scale. So thank you so very much again, and I think that we're going to have like 5 minutes to some questions that we can have, and I'll be happy to answer them.
All right, so there are some questions from Christian. How do you think we could bring this to more devices? At the moment, it's restricted to the fine phone, but then the option to have a web interface, for example.
Right, thank you, Christian, and thank you, by the way, by providing the PySite 2. Christian is the main developer behind the PySite 6 at this moment. So basically, depending on the components that we have, we use different interfaces. The hospital management information system can be used both as a client-server application, or you can also use the web interface. MyGNUHealth, today we're using the Qt framework, but the data gathered at the federation level, you can query it using web services. So it's not really one single device or one single application, but it's an ecosystem. So any free operating system that can be installed in a single board machine or in a mobile phone or in a large computer or server. As long as we use the components within MyGNUHealth, you will be able to gather that information into a very large health information system, and from there give it to the Ministry of Health or to the scientific community for the betterment of our societies. So yes, we do have a web interface for the both the lab information system, health information system, and the federation. We should probably do the same somewhere along the line with the application. But at this point, the Qt, the PySide application is working quite well.
All right, so the next question is from Fotis Nikolaidis. Nice talk, Luis. I would like to ask about the Federation of Health. What is your proposed model? Every institute will run GNU Health, and these instances will share data. If so, how can you guarantee that users' sharing policies are enforced?
Right, very good question, Fotis. So basically, what we have is we have an access control list, and based on the profile of the individual or the institution, you will be able to read, write, or execute whatever processes, right? At the user level, you, if you see MyGNUHealth, you will be able to say what do you want to share with your health professional. So for example, if you create a page of life and you want that page of life, for example, if we are within the psychological sphere and you don't want to share what is your mood or what is your level of energy or whatever, you just click it private and that information will remain only for you. Now, if you want to share stuff like, you know, your genetic information with your genetist or with your primary health physician, you can, of course, do that. And you can also do it anonymously. So that will definitely help to build a better open science community around it. So yes, you enforce what you want to share, and on the other side, due to the different profiles, you will have people that have limited access to those resources. Thanks. Yeah, well, you can activate auditing, so that will historize every single actions that you do, whether it is write or read. And also by using public key cryptography, anything that has been signed, it will have, of course, the non-repudiation status, right? So by activating auditing, you will have recorded all the actions done in different resources. And then if you want to make sure that whoever does something is signed, as for example, if you want to prescribe something, you can use the crypto module that we have to either encrypt or to sign documents.